progression that we're going to use in the parallel bars, just because it's easier to get up and down from there. Also slightly more aggressive since we are up higher, so the stretch is going to be a little bit more effective. But the idea is to have a person sit down on the foam roll, lower themselves down like that, keep the chin tucked, the low back flat. From this position, you can go into a T stretch position. If they don't have enough flexibility, keep those arms down to the side like this. But the idea is to just get a nice stretch. Sometimes we'll do this for up to 5 minutes at a time. And this can be combined with even some overhead stretching where you have a stick here. And not even a stick at first, but just stretching overhead like that. That's good for shoulder patients where we're doing low load prolonged stretching. You can do stabilization on this where you're doing a dead bug with a pretty flat back. Use the hands for support at first, and then doing lower extremity extensions like this. And then as they get better at that, they're not using their hands. That's a tough one. That's a really tough one. You want to make sure their hands stay here so they don't roll off. You could even give a little extra credit where you do that for stability, and then you raise up for a little bit of a hamstring stretch. If they have sciatic nerve issues, you have to be careful with straight knee activities when the ankle is bent. Ultimately, that could be a good way to restore nerve mobility, but if they have a hot sciatica, do not have them do aggressive stretches with the knee straight and ankle bent. And that would apply to something like this. It would also apply to the lower extremity pullovers. From here we can go crossways and do our crossway stretch. And the idea is to just fulcrum over this. Sometimes you'll hear a little pop. We do a thoracic mobilization like this too that I'll show you later, but trying to just work every bit of that, actually having them roll up or down to get the stretches better, and then ultimately using this as a rolling pin is just a really good exercise, keeping the chin tucked the whole time. When they come up from there, we're going to be like that.